Good evening, doctors and dear audience. Welcome to RWD Vet Academic Channel, and thank you for your attention. I'm the host of the webinar. My name is Shelley, and I'm the sales representative of North Africa, including Morocco, Algeria, etc. It's a pleasure to connecting with all of you tonight. RWD is life science company focusing on animal health. Under more than 20 years history, we try our best to provide comprehensive service in anesthesia management and ventilations in practice, dental health cares, and recovery options. RWD's products are trusted by over 11,000 pet medical institutes and 130 countries and regions. In addition to providing veterinary with superior products, we also looking up to spread knowledge from experienced doctors. So we launched this channel for medical technique communication. This webinar is accredited by CPD, and the attendees who stay online for more than 30 minutes will earn CPD credits. So if you have not shared your CPD registration number yet, please send it to our email after the session. We will proceed with your certificate. So tonight's topic is the European veterinary specialist in dentistry. It's both timely and critical for modern practice. We are honored to have Dr. Surgery Third, a globally recognized leader in veterinary dentistry. He is the member of the European Veterinary Dental Commitment, certificates orals and maxillofacial surgeons. Dr. Third's manuals, including small animal dentistry and Basava's dogs and cats dentistry guide, are essential reference for vets worldwide. My dear audience, if you have any questions during the webinars, please feel free to type in the chat box and the Q&A modules. Dr. Third will answer that after his presentations. All right, now I will pass the times to Dr. Third. Please join me to warmly welcome Dr. Surgery Third.
Thank you for the introduction, Shirley, and good evening, colleagues, or might be morning for some of you, but good evening to those who are in the Southern Hemisphere. It's great to be with you again, and tonight we're going to be speaking a little bit about veterinary dentistry, how we go about equipping the room that we're going to use and how we're going to use some of the equipment. And then later on, we'll talk about or cover any questions that there might be. So welcome. Unfortunately, we're having technological issues tonight, so Shirley's going to be controlling the slides for us. So if I say next, it just means that Shirley needs to move on to the next one. So thank you, Shirley, and we can go to the next, please. All right, so when we are thinking about veterinary dentistry, there are a few things that we need to make sure are on board for us to be able to do the job properly. And can we just go back a bit, please? Back one slide, please. Okay, sorry, go back the other way. Back one more. Shirley, can we start again, please? Okay, so what is required for us when we are going to be doing veterinary dentistry? Obviously, we're going to have knowledge, and that's maybe why we are meeting this evening, is to share the knowledge. And we need to develop the skills that are required. If we don't have patients, then I'm afraid dentistry isn't something we're going to be able to do, because we need to have patients to, for instance, do an extraction. We need to have patients to be able to tear the ligament before we can get rid of the tooth or extract the tooth. If we're taking radiographs, we might need to repeat the radiograph. So we need to have patients, And then we need to have a desire to improve the oral well-being of our patients, and we need to have appropriate equipment, which will then be discussed this evening. Thank you. Next. Veterinary dentistry can be performed using hand instruments only, so we can examine the teeth, clean them, we can extract them, all using hand instruments. Next. However, if we use electromechanical and pneumatic equipment, we can get the procedure done a whole lot faster, more efficiently, and therefore safer for the animal. Next. The hand instruments that we use for examination include the periodontal probe, which is a very important instrument. Without the periodontal probe, we can't actually examine the mouth fully because the probe is required to measure the sulcus. It's required to measure overgrowths and recession and so on. So we need a periodontal probe, and the dimensions of which we need to know as well, and we'll talk about that a bit later. The dental explorer is another instrument that we use when we examine the teeth. It has a very sharp point, and it's used to find out if there are any defects in the enamel of the tooth, and it can be helpful when we examine underneath the gum line when we're looking for resorptive lesions as well. The dental mirror is something that is commonly used. I personally don't use it very commonly because I have an issue with 3D, but those who learn to use the mirror find it beneficial. So we can use the mirror to look at parts of the tooth that are away from us. We can even reflect light into the area that we want to visualize using the mirror. What I commonly use the mirror for as well is if I want to look up into the nasopharynx. So if I want to see what's going on up in the nasal passages, then I will slightly retract the soft palate and put the mirror behind that and then reflect light into the caudal nasal passages, and I can view them. Dental chart is essential. Gone are the days where we can write in the clinical record, dental done today. We need to have the chart that we're going to examine the animal and record the clinical findings, and then the treatment that we perform on the animal as well. We need a good light source, and what I mean by a good light source is that we don't necessarily need to have a window in the room through which the sun shines. Sometimes the sun shining in the room can be quite dazzling, and therefore we can't see in the mouth. So having a good operating light that comes from behind us and pointing in the direction that we are looking is going to be beneficial for us to be able to have a look inside the mouth. And then obviously we need an anesthetized patient. I've just returned from abroad where I had questions in a number of different countries from colleagues who have examined animals that have recently been treated at pet shops or grooming parlors where they offer a dental cleaning service, and they boast about being able to do it without the animals anesthetized. Well, unfortunately, that's fake. Okay, you cannot examine the mouth of an animal completely and do a proper scale and polish with the animal conscious. It's just not possible. Okay, we are working with water in the mouth, and we are working with instruments that cause discomfort, and therefore we need to be sure that the animal is anesthetized properly when we do that. Next. The instrument at the top of the picture is a combination periodontal probe and explorer. On the left-hand side, we have the periodontal probe. On the right-hand side, we have the explorer, and beneath that then is a mirror. Next. We need to know the dimensions of the probe. So if we look at this probe, it's known as a Williams 14 probe. The first three graduations are 1 millimeter apart, the next two are 2 millimeters apart, and the last three are 3 millimeters apart. So the graduations go 1, 2, 3, 5, 7, 8, 9, and 10. So if we place the instrument into the sulcus or into a pocket, and we count how many stripes are left outside, then we know how deep the pocket is. Next. Again, just different types of instruments. The one at the top has got millimeter markings on them. So the first four are single bars and then a solid black bar, and then the next four are single bars and then a solid black bar. And depending on what instrument we have, these might come in a different configuration, but we need to know what they are so that we can record our findings more accurately. Next. On the left, we have a probe that has 1 millimeter markings. On the right, we have the W14. So as I have said, and I'm repeating myself a little bit, we need to know the dimensions, because when we are going to record on the chart, we want to know exactly how deep the sulcus or the pocket is, or how much overgrowth of the gingiva we have, or how much recession. Next. Dental charts come in a number of different formats. This one you can see the findings are recorded on the left-hand side, and then what needs to be done is written on the right-hand side with some instructions for home care on the right-hand side as well. So the next one. Is the chart that we use. On the left-hand side, we have the clinical findings, and then on the right-hand side, where we have treatment there, the treatment is recorded on the chart as well. So clinical findings on the left, treatment on the right. On the top right of this chart are the different shapes of the head and the different configuration of the teeth. So if the teeth are more splayed out or more upright, we can tick a box to say which one is involved. And then on the left-hand side at the bottom, we have the buccal view of the teeth, and at the top we have the occlusal view. Next. Computer-aided forms are available as well. This one's quite convenient in that we can add X-ray images as well, which you can see at the bottom. Next. Hand instruments that we use generally these days include calculus cracking forceps, which are forceps that are used to chip the calculus off the tooth. We need a dental scaler, a dental curette, and then we need a polisher as well, which often involves either a micromotor or a pneumatic air-driven motor. Next. Calculus chipping forceps, these are just two different formats, basically of the same thing. It has a long beak and a short beak. The long beak is placed on the tip of the tooth crown, and the short beak is placed on the calculus. And then the force that is generated when we close the calculus, moving forceps, causes dislodgement of the calculus, and the calculus then comes off of the tooth surface. Please be sure that one of the beaks is on the calculus and the other on the tooth surface. Do not straddle the tooth, because if we do, two things might happen. Either we might splinter the tooth if we apply too much force on it, or if it's a cat that has a resorptive lesion, we might actually extract the tooth using these forceps. So please be careful. Next. Here you can see the short beak on the calculus and the long beak on the tooth tip, and then the force will then dislodge the calculus. Next. Here we can see some calculus that's been dislodged using the forceps. We can note also that the gingiva has become discolored here. There is chronic inflammation from the calculus and plaque on the tooth, and that has resulted in pigmentation of the gingiva, and sometimes it would be wise to take a biopsy of that and send it off to the lab just to make sure it's not converting into some form of tumor or another. Next. Curettes are used underneath the gum, and the scalers are used above the gum line. So curettes are available in different shapes and sizes. There are some with a short blade, some with a longer blade, and then the shanks can be long as well. So depending on where we're going to be working in the mouth, normally we would use a different scaler or a different curette, but in dogs and cats, generally speaking, we'll either have a smaller or a larger for the different size animals. We don't really go through the whole range of curettes, which might be 15 or 20 that are used in humans. Next. Scalers have got sharp points on them, and therefore they should only be used supragingivally, in other words, above the gingiva. If we place them under the gingiva, there's a risk that we actually lacerate the gingiva. So please be sure when using a scaler that used above the gum line. However, the curette, because it has a nice curved back to it, we can place it underneath the gum and remove whatever calculus is under the gum without actually damaging the gingiva itself. Next. Next. Electrical instruments include the scaler, polisher, and a micromotor. Next. And scalers are available in a range of different formats. On the left-hand side, we have two magnetostrictive instruments. On the extreme left, we have the metal stack. The centered one is called a ferrite rod, and they both work in an elliptical fashion. Their vibration or oscillation is in an elliptical pattern, and their action is happening all along that pattern that they develop. Whereas on the right-hand side, we have the piezoelectric instrument, and the piezoelectric has a linear motion. So only the tip of the instrument is working at any one time. Both of these types of handpieces have cooling water that flushes through them, and the water, when it comes through, is affected by the oscillation or the vibration of the instrument, causing the water to bubble, and those bubbles then implode, and that helps to disrupt the calculus on the tooth surface, and also it helps to disrupt bacteria, and that is called cavitation. So when the bubbles in the water implode, they can then help by destroying bacteria and also help to dislodge the calculus. Next. Piezoelectric scalers can also have LED lights just at the base of where the tip is inserted into the handpiece. There's often an LED light there, which provides some illumination in the area that we're going to be working. And then to the right-hand side, the instrument with the black handle is a sonic scaler. And this instrument is attached to the high-speed handpiece. And when we put our foot on the pedal, there's an eccentric rod inside this instrument that when the air flows past it, causes vibration of the tip. So this is more mechanical type of vibration than the others, which are either electric or by a crystal. Next. Some of the electric scalers that we use can be used subgingivally, especially those that have a water source that is near the tip of the instrument. So we don't want the instrument to be under the gum for any period of time without being cooled, or else it's going to cause gingivitis and damage to the gum itself. Always be careful when you're using the scaler that part of the scaler tip doesn't touch the soft tissue. So when the tip of the instrument is on the tooth, remember we don't use the point itself, but the tip, when the tip is on the tooth, make sure the rest of the instrument isn't touching soft tissue, or it is going to damage the soft tissue. Next. Polishers come in a number of different shapes and sizes as well. And you can see here on the left-hand side, we've got 3 different polishers. They're different colors. The rubber cups are different colors as well, and those have different density. So some cups are softer than the others, and generally speaking, in veterinary dentistry, we're going to use a medium texture cup. And then the system that I prefer is the one on the right-hand side, which is a reciprocating one. The reason I prefer it is, first of all, the cup is moving back and forth and does not generate much heat. And secondly, because it moves back and forth, it doesn't wind up the facial hair of the animal. We all have probably had a Yorkshire Terrier that's been attached to our scaler, our polisher at some point in life. But using one that is reciprocating is the preferred one to use. Next. These are the different hand pieces that can be used for polishing. On the left-hand side, we have the straight one, onto which we can place those plastic fittings that we've just seen. The middle one is a push-button, low-speed unit that we can push a polisher in that has a stem. And on the right-hand side, we have one that has a latch key. So once again, we put a low-speed polishing cup into that. There's a bronze or stainless steel shaft that goes into that. We clip it in position, and then we use that to polish the teeth. Please remember, do not apply too much pressure when polishing, because that too can damage the tooth itself. Next. Air polishing is something that I think we should be doing more of. It is a very good means of removing plaque, especially that tenacious plaque that is on teeth that takes such a long time to scale off. It is normally soft, but you can't just scrape it off. You have to use the scaler to take it off. But using the air polisher or particulate polisher, it's almost like sandblasting. The crystals that are used, they are often bicarbonate crystals, and then that gets combined with a slurry of water and air, and when it is then directed at the tooth surface itself, it polishes the surface quite well. These polishes can damage the soft tissue, so if we're going to use them, we need to place a gauze swab on the gingiva just to make sure that we don't abrade the gingiva itself. Next. Just one of the birds that we sometimes find in our garden. They're quite noisy at night, but a nice bird to have in the garden. Next. So the electrical and pneumatic instruments that we can use include scalers, polishers, the three-way air water syringe. Those of us who have them will know that the one button will produce water, the other one air, and when we depress both of them, we get a fine mist coming out of it. We also will use a high-speed handpiece and a low-speed handpiece, and these are usually driven by air pressure, but in some situations, some of the more modern instruments are reverting to some of the older technology, although it's new technology again, and that's using micromotors, both for the low-speed and the high-speed units. Next. So these are some of the instruments that we are showing today that are manufactured by our sponsor RWD. And on the left-hand side, we have the Pro unit, which includes a suction as well as a scaler, although the scaler on the Pro is a separate unit compared to the U2000. The U2000 has a smaller air supply bottle, but they are equally good when it comes to doing our veterinary dentistry. Next. So the U2000 has a scaler on the left-hand side, then a low speed and a high speed, and then the three-way air, water, and syringe. So here the scaler is built into the unit, and I find that a very useful combination of instruments. And for me, this is the basic ideal unit that one can use in everyday dentistry. Next. And then at the bottom, we can see the reservoir tank, which is a fairly small reservoir tank, but the compressor itself is quite sufficient, and therefore we will have a constant flow of air even when we use the handpiece. And then we have a foot pedal to control the instruments, which is shown at the bottom. Next. Next. And then the Pro we can see has the additional instrument on the left-hand side, which is a suction, where the three-way, low speed, high speed, and then the scaler is mounted on the top of the unit. Once again, a nice compact unit and very beneficial to use in the practice. Having the suction there is also beneficial when we are doing scale and polish, also when we are doing any restorations and so on that might require flushing of additional water into the mouth. So using a suction is beneficial in that case. And then the next one just shows the foot pedal again and the air supply tank, which in the Pro is bigger than in the U2000. Next. Next. Okay, so we have two pedals here. One of them is to control the suction and the other one is to control the instruments. And then for the veterinary dental setup in one's practice, this shows basically what is available from RWD, and this includes an anesthetic machine and a monitor, a dental x-ray machine, the dental unit itself, and then the dental hand instruments. Next. And the difference between the two, again, just between the Pro and the P2000. Moving on to the hand pieces, the high-speed burrs that we generally use are going to be a 701, which is a straight one. We can use a round one as well, and they vary in size depending on what we need to achieve. And these burrs are considered to be one use only. The reason for that is we don't want any cross-contamination. And secondly, if a burr is blunt and we use it continuously, then it is likely to damage the bearing of the high-speed handpiece. So please ensure that you use it once off. What we do is that we can charge the client for the burr. So use it once off, you've charged for it, and then put it in the bin and use a new one for the next animal. Next. This is just a different kind of unit that's available. It's got a scaler on the side and a handpiece that is a micromotor handpiece, and this one can be used for sectioning teeth as well as polishing. So just a different kind of instrument to show that there are instruments that work solely on electricity rather than having a pneumatic requirement as well. Next. High-speed burrs, we need a range of them because we're going to be doing different things. So on the left, you can see three round burrs, and then we've got two cross-cut burrs. Then we have a diamond, a long diamond burr, and then a flame-shaped diamond burr. The flame-shaped we often use for smoothing bone off after we've done an extraction. So a range of burrs is beneficial to have, especially when we are dealing with cats and small dogs, and then larger dogs as well. Next. These are just other high-speed burrs that are available in a diamond format. You'll notice that there's a pattern on the burrs, and these are actually called cool burrs because the manufacturer states that the water will be running along the surface in that groove that is running down the surface of the burr itself. So it keeps the burr clean and also keeps it cool as well. Next. Polishing burrs we can use where we have defects on the tooth that are superficial. If we just want to take a sharp edge off, we can use these stones. The green stone is a bit more abrasive than the white stone, and they're available in different shapes, and there are other colors as well that give us different textures of the polishing stones. Next. Low-speed burrs are available again in a range of different burrs. The most commonly used ones in our practice are the round burrs or pear-shaped, and they are usually used to debride lesions on the tooth and to clean the excess if we need to do a restoration in the tooth. They're quite handy to use. On the left-hand side, you can actually see a diamond-coated one, which is less abrasive than the others, and we can do some finer work using that. Next. These burrs, known as acrylic burrs, are what we would use in rabbits and rodents. They have sharp blades, but even though the blades are sharp, they are not inclined to damage the soft tissues of the rabbit because they don't snatch the soft tissue like some of the cross-cut burrs do. So these, because they have a wider surface area, they can get the job done, but they are less traumatic to the soft tissues. Next. We need a small surgical kit, and this will include a scalpel handle, periosteal elevator, tissue forceps. Please be sure the tissue forceps that you use are small, not so small that they damage the gingiva, but also, again, not so large that they puncture holes in the gingiva when we use them. We need some tissue scissors. Metzenbaum, small curved Metzenbaum are quite useful. Iris scissors are important for doing dissection in the connective tissue between the oral mucosa and the periosteum, so that we can get a flap to advance. And these need to be sharp, so both tips are sharp. And then please make sure that you have a set of suture scissors in your kit as well. We don't want to be using surgical scissors for cutting sutures, so include a set of suture scissors too, please. Next. This is just an example of the kit. We've got needle holders on the left-hand side. The sutures that we use are going to be 4/0 or 5/0 suture material. Most commonly used, and the suture material of choice is called monocryl. Its active ingredient is polyglycaprone 25, and those needles are quite small. Some of them are 30 millimeter and some are 16 or 19. Please be sure that the needle holder that you use is small enough that the jaw doesn't flatten the needle out into a straight needle. So make sure it's a nice fine instrument for picking the suture material up, or sorry, not the suture material, the needle itself. Just a reminder as well, grasping the suture material with the forceps, other than where you're going to cut the piece off that you've just tied, is going to weaken the suture material. So never grasp the suture material itself with the forceps. If you need to move it, fold it over the forceps and use that as a lever to move it along rather than grabbing it by the jaws of the forceps. The next instrument along is the suture scissor, and then we've got a scalpel handle. We prefer to use an hexagonal scalpel handle, or one that has a round surface like a pencil, because we find it's easier to maneuver those around the surface of the tooth. And then iris scissors, and then tissue forceps. And then another instrument that we can't do without in veterinary dentistry is the periosteal elevator. And since we work on a number of different size animals, we need to have a range of sizes of periosteal elevators to help us when we are creating flaps. Next. So the surgical kit includes a needle holder with fine jaws. As we said, we need some suture material. We need a soft tissue retractor, which wasn't shown in the last picture. What I prefer to use for soft tissue retractor is a plastic spatula, or in some situations, I prefer to use a tongue depressor, a wooden tongue depressor. If that's too wide, we can split it into smaller pieces, or I found that some coffee shops actually have stirrers that are plastic or wooden that actually work well as soft tissue retractors as well. Gauze swabs are essential. We prefer not to use cotton wool, because cotton wool has fibers in it that can become attached to the bone, and then we have bits of cotton wool left in our wound, which is undesirable. So gauze swabs are what we're going to use. And then any tissue that we cut off during the process of our dental surgery or oral surgery needs to be sent to the lab. We need to know what it is. And therefore, what I do is I will take it off, put it in the bottle, and say to the client, we've taken this off, can we send it to the lab? If they say no, we say, okay, we'll keep it aside. If it grows again, we then submit it to the lab rather than having to go in and take a second biopsy at a later stage. So always keep those biopsies in a cupboard, and we can submit them at a later stage if necessary. Surgical masks are essential because we're generating an aerosol that includes bacteria, and it's not very good to inhale that. Some of our colleagues have developed pneumonia from doing dental procedures in animals, so please be careful of that. And then surgical gloves. We need to protect ourselves by wearing gloves, and if necessary, we can use drapes when we do our procedure. Some people like to do the dentistry using a drape. We don't in our clinic, except when we're doing oral surgery, but drapes are a possibility as well. And the other thing is, some people insist that we wear headpieces. I'm quite okay with that. If you want to wear a headdress when you do the dentistry, is absolutely fine. If not, obviously, you need to have a shower. And for those of you like me who have a bit of fluff around the face, the mask doesn't cover all of that. So having a good shower at the end of the day is essential. Next. Some of the needle holders, I've discussed that already. It doesn't matter what kind of needle holder you like to use. These are different variations of a needle holder. Whatever you're comfortable with is what you should use. But the needle holder beaks must be small enough not to damage the needle. Next. Some elephants in Addo Elephant Park. Some of you will know Addo Elephant Park. It's near a city called Gqeberha, used to be called Port Elizabeth, about 800 kilometers east of Cape Town. Next. Okay, then the RWD range includes digital X-rays. Next. And the transducer that's available looks like this. So there's a small device that you can see at the end of that coil sitting at the 12 o'clock position. And that's what we place in the animal's mouth. The silver bit is the USB that connects to the computer. And we expose that then using a dental X-ray generator. And then an image is captured by the software, which you see in front of you there, called the XCMOS software. So quite a handy situation. Handy system to be using for veterinary dentistry. Next. On the left-hand side, we have the X-ray generators. These might be wall-mounted, they might be mounted on a trolley, or they can be handheld, depending what's available. We use both. Using a handheld one is beneficial in that when you position it, if your X-ray image that you get isn't exactly what you want, you can just then move the X-ray tube head only, because the sensor will still be in the mouth, and then you can change how you view what you've taken. So you can get a better X-ray image just by moving the X-ray generator itself. Next. The device that's available through RWD is waterproof, and it has a flexible cable, and it is quite durable. So it is something that is recommended to be used in the mouth of the animal. Please always remember to put the plastic sheath on these so that we reduce cross-contamination. But you can see on the right-hand side there, it says that it can be disinfected by dipping it into the disinfectant fluid. So that is a benefit of using this kind of instrument. Next. Another type of X-ray system that we can use is the CR system. This is a CR reader. There are a number of plates. Next. The plate sizes range in this particular case from 0 to 5, and we can put the plate in a sheath that protects it, place that in the mouth, expose it, take it out the mouth, put it into the scanner, and then we get an image on the screen. So the initial one that we saw was a direct system. This is indirect, and they both give us good quality radiographs. The benefit of the one over the other is that in the CR system, plate sizes are bigger than in the DR. However, there is a new DR plate that is out. It used to be 0, 1, and 2. Now there's a size 4 as well. So there's a DR size 4 that's available as well. Next. Handling the dental equipment is something that we need to be aware of when we're going to use them. The periodontal probe, dental explorer, scaler curette, and the periostal elevator all handled using the modified pen grip. In other words, when we are going to hold them, we hold them between our index finger and our thumb, and our middle finger then is going to project past those two onto the tip of the instrument. So if we are going to apply some force on the instrument, we can push it down with our middle finger. High-speed and low-speed handpieces are also used in the modified pen grip, and never in the palm grip. Palm grip is the way we would hold, let's say, the bread knife when we're going to cut bread. We hold the whole thing in our hand. Okay, that's a palm grip. And we don't use that grip when we use the dental high-speed and low-speed handpieces. Use the modified pen grip. Next. How we hold the instrument then, this is the high-speed handpiece. You'll notice that the fourth finger is resting on one of the teeth. So the thumb and index finger and the third finger are all engaged on the handpiece itself, and the fourth finger is resting on the tooth. So we use the fourth finger on the tooth as a fulcrum that helps us to control the action of the handpiece. Next. Another bird in our garden that we see periodically. Next. Luxators are essential when it comes to doing extractions. Luxators have refined tips. They can fit into very small areas, and they can easily be inserted between the tooth and the bone in the periodontal ligament space. Next. These are modified winged elevators. They were designed by a colleague of ours, Dr. Wiggs, who passed away some years ago. And these are also very useful instruments. One can apply more rotational force on them than one can on a luxator. You'll notice the difference in handle sizes here and shaft lengths. And the one on the right-hand side is more comfortable for people with smaller hands, and the one on the right-hand side is more comfortable with people with smaller hands, the one on the left with people with longer hands. Please remember that the tip of your index finger must be as close to the tip of the instrument as possible, so that if the instrument slips off, your finger is the stop to prevent it from causing any damage. When choosing instruments, the size of the instrument should be more or less the same size as the root. It's no use using a 1 millimeter instrument on the tooth that has a 6 millimeter root. And again, no use using a 6 millimeter instrument on an incisor that is only 1 millimeter. So choose an instrument appropriate to the size of the root. Next. Root tip picks are really, really good to have in the practice, and they can often save us quite a lot of sweat. When we have a root tip that is fractured, we can get the instrument underneath it and then tip the root tip out. Next. Forceps, we need a range of forceps again, and forceps have different appearances when we look at them at the front. In the middle here, we can see that the beaks almost come together. On the left-hand side, there's a bit more space between them, and on the right-hand side, even more space. So depending on the size of the tooth that we need to extract, we will use a different forceps. So if the tooth is very small, we need to use an instrument where the beaks close more. If the tooth is bigger or the fragment is bigger, then we can use an instrument that closes less completely. Next. I like to use these root tip extraction forceps as well. They need to be very small because we're going to put them inside the alveolus to go and retrieve the tooth remnant. So they need to be very fine, and we need to be careful when we use them that we don't push the root tip out of the alveolus, either into the nasal passage or into the mandibular canal, because the bone around these roots is usually compromised as a result of periodontal or periapical disease. Next. Okay, so how we go about examining the animals then? Next. You can see here that a periodontal probe has been used, and if you just give us the next slide, please, you can see that the instrument has passed through between the roots. Next slide. Okay, that's what the instrument looks like, and we can see that here it's passed through in between the roots. That gives us a furcation score of 3, which means that the tooth has got to be extracted. In this case, we're measuring a recession of the gingiva and the bone, and here the recession is about 6 millimeters. So we can use the same instrument to measure a recess or a recession as we do to measure an overgrowth or pocket depth. Next. Using the scaler, we must never use the tip of the scale, sorry, the point of the scaler. The point of the scaler is very aggressive. So make sure that you don't put the point of the scaler on the tooth at 90 degrees to the surface of the tooth, or it's going to damage the enamel. Here you can see the instrument is placed edge on the tooth, and the water flow is helpful to flush away the debris, keep the tooth clean, and also for the cavitational process. Next. When we take x-rays, we want the film to be placed in the mouth in some situations parallel to the tooth. So in the mandible, behind premolar 2 in the dog, and premolar 3, 4, and molar 1 in the cat. We can place the film parallel to the teeth in the jaw, and then the x-ray beam will come in at 90 degrees to that, and we get a good image then of the tooth on the plate, either on the plate or on the computer screen. Next, please. Where we can't place the film parallel to the tooth, we place it as close to the tooth as possible. In this case, you can see we have an illustration of a maxillary P4, which has 2 roots at the mesial part of the tooth. And you can see here in green the plate that is being spanned across the palate. And then we form an angle between the axis of the tooth and the axis of the plate. That angle is divided in 2. That's why this is called the bisecting technique. And the x-ray beam then comes in and is perpendicular to that bisecting line. And that again will give us an image that is more or less the same size and shape as the tooth itself. Next. Okay, next. Next. Okay, when we're extracting teeth, often there is no space between the tooth that we're going to extract and the tooth that needs to remain in the mouth. So sometimes it's beneficial to shave a piece of the tooth off that we're going to extract to create some space into which we can place our instrument that it can more easily access the periodontal ligament space. Next. Once we have sectioned the tooth, we're going to use an instrument that we're going to drive between the tooth and the bone. And once the instrument is nicely positioned in between the tooth and the bone, we can apply some rotational force to it, which then helps to tear the ligament down, and we can then loosen the tooth up and extract it. Next. Extraction forceps can be used. Next. And when we use them, we must apply an intrusional force. When you hold the tooth firmly, we apply an intrusional force and then apply a rotational force at the same time. Next. So we're going to push the forceps in, we're going to turn it in one direction, and then afterwards we'll turn it in another direction as well, and we can then deliver the tooth out of the socket. Okay, so it looks if we've come to the end of the lecture session itself. We have some time for questions, and I don't see the questions because Shirley's controlling the screen there for us, so she's going to tell me what the questions are. Thank you, Shirley.
So if you have any questions, please type in the chat box or the Q&A models, and Dr. Turt will answer your question. Dr. Turt, can you see the chat box of the Zoom?
Yes, I can see.
Yes.
Okay, there's the first question is about the polishing devices. The straight hand piece is used when we are going to use the plastic polishing devices, which are disposable. So the plastic device fits onto the straight hand piece. The contra angle is used also for disposable polishing devices. However, those contra angle devices, where the handpiece is the contra angle, they're going to turn in one direction only. So they're going to be rotating instruments rather than reciprocating. So in the one where you use the straight nose cone, we can put a reciprocating polisher on. Some of them do rotate, as I said. But For me, it's better to use the reciprocating one in the straight. The contra-angle one we used to use for many, many years. We just need to remember we must change the polisher between patients. Obviously, we're going to do it when we use the plastic one as well. So always change the polisher between patients. Okay, the next one from Katie. Gingival pocket of more than 4 millimeters on the canine tooth. Do we cut away the gingival pocket? Okay. If the dog is a Chihuahua, then we can do a bit of gingivectomy to reduce the pocket depth. If it's a Great Dane, then we're probably not going to worry about it. We just need the client to clean it. Remember, the pocket depth or the normal gingival sulcus depth of 3 millimeters in the dog. We need to give or take a little bit. So if it's a small dog, it needs to be less. If it's a big dog, it can be a little bit more. If the clients cannot keep it clean, yes, by all means, we can do a bit of a gingivectomy and reduce the depth. See, there's one more question down there. Compress the difference between oil-free and oil. Okay, oil-free compressor makes more noise, but because it's oil-free, it means that there's no oil in the line. Generally speaking, though, if it is an oil compressor, there'll be a trap in the line that removes the oil. The reason that we don't want oil is that we don't really want oil in the mouth. And secondly, if we have oil in the mouth, it's going to interfere with any restorations that we put into the mouth. So using oil-free is better. However, if you have one that does have oil in it, they're much more silent. And there's an oil trap in the line that will ensure that the oil doesn't reach the mouth. So either of them can be used. Okay, there's another one. If a cat has feline stomatitis, is there any other treatment besides full mouth tooth extraction? No, once it gets to stomatitis, full mouth extraction is going to be the treatment of choice. What we find in our clinic is that the earlier we can do that, the better result we get. So if we have a very young animal and it already has gingivitis and periodontitis, we'd rather extract the teeth, even if the animal's only a year old, because the response is much better in our experience. It's not published at this point, but in our experience, it's a lot better. So we prefer to see an animal at a year and extract the teeth rather than seeing it at 7 or 8 years when it's been on prednisolone for half its life and it's almost becoming a diabetic. So extraction is the way to go. Treatment of gingival case in the cat. Okay, tooth brushing is the most important treatment that we can give any animal when it comes to looking after the mouth and looking after the teeth. If we can keep the gingiva healthy, then we can keep the periodontium healthy. If we can keep the periodontium healthy, we keep the teeth in the mouth for longer. So it's always important to make sure that we can reduce the gingivitis as much as possible. So tooth brushing is the best. Some animals respond quite aggressively to plaque in the teeth, and when we examine the mouth, it looks as if there's no plaque there, but there's massive inflammation, either gingivitis or stomatitis, or a combination of gingivitis, stomatitis, and periodontitis. So the best way, as I said, is to use toothbrushing. We can use oral antiseptics. We can use lactoferrin. We can use some of the seaweed extracts to try and reduce the amount of plaque on the teeth as well. So yeah, there are a number of things, but as again, I know I've said it for the third time now, toothbrushing is the essential part of it. If we can't control it with toothbrushing, the client can't brush the teeth, and if using an oral antiseptic like chlorhexidine doesn't keep it under control, then the next move is to extract the teeth. Okay, now that was gingivitis again. Significant difference in the longevity of pneumatic or micromotor systems. Okay, it depends on which micromotor system you have. So the question is there a significant difference in the longevity of pneumatic or micromotor systems? Depends on the micromotor. Original micromotors weren't made for cutting teeth, or some of them. And if one put a burr into them and cut the tooth, often the motor would burn out. Okay, and that's obviously not covered by a warranty because it's misuse of the instrument. However, there are some manufacturers that make micromotors that are made to cut teeth. So the one that I showed you, the blue and white instrument, that one's made for cutting teeth. There's another range of instruments that are available these days. Although I said earlier on, it is old technology. It's old technology that's been modernized. So we've gone from micromotors that couldn't be used for cutting teeth to those that can be used, and they will last for a long time, used according to the manufacturer's instructions. The pneumatic ones are also instruments that can be used for a long time, but we need to remember, using an instrument, it depends on how the instrument is used itself. If we take good care of them, they can last for a long time. If we drop them, it's going to cause problems. If we use blunt burrs in them, it's going to mess with the bearing. So it all depends on how we are going to use them. Pneumatic ones today, I think the most commonly used ones are the ones that include some form of illumination as well. So a lot of them have a small dynamo in the handpiece, and as the air flows up the handpiece, it generates its own electricity for the LED that's there. So those are really, really useful. I'm not sure at this stage if the micromotor systems have them. I haven't seen one. However, there are some low-speed handpieces that fit onto electric motors that can generate their own electricity for LEDs as well. So either one. The other thing to remember is when you use a micromotor for toothbrushing, if it's rotating, because it has a much higher torque, there's a higher risk of burning the tooth. Whereas the pneumatic one, if you press it too hard, it's going to stop rotating on the tooth, whereas the electric motor will just continue generating more frictional heat. Okay, chlorhexidine mouth rinse. The one that we used to use a lot of is no longer available in South Africa, a Verbac product. But the one that we in our clinic use most commonly is the one that is made by VTech, and it's just called chlorhexidine oral rinse. I think there's another one called Pet Dent. The way I look at them is that if we wanting an oral antiseptic, I will use the liquid form. If I want to use it for treatment, in other words, the animal already has gingivitis, and I want to control the gingivitis, for instance, where there are chronic ulcerative periodontal lesions, then I would use the gel, okay, because it sticks a bit better. But so once again, gel as treatment, whereas antiseptic liquid as the preventative. Okay. In a puppy or kitten consultations, would you advocate toothbrushing? Yes, absolutely. Okay, toothbrushing must start as soon as possible. So if the puppy is seen for the first time at 6 weeks, that's the time that we would teach the client to start brushing the teeth. The sooner they start brushing, the better. However, it's interesting in multi-dog households, if toothbrushing is implemented, then the dogs will actually queue up to have their teeth brushed. My sister has brushed her dog's teeth forever, since I became involved in veterinary dentistry. And each time she gets a new puppy, that new puppy is taught to have its teeth brushed, and the other dogs sit in a queue waiting for their teeth to be cleaned as well. So yes, from an early age, puppies, including kittens as well. Okay. Do we give antibiotic prophylactically or only when we have done extractions? And if the mouth is relatively clean, but there's 1 or 2 loose teeth, do we still give antibiotics? Okay, antibiotics are only used when indicated. They're not indicated for scale and polish. They're not indicated for extraction of a healthy tooth. The only time that we might use antibiotics, or we do use antibiotics, is in animals that have chronically inflamed mouths, animals with other comorbidities, so renal disease or cardiac disease or something similar, we might use antibiotic. For straightforward extractions, we don't use antibiotic. If the tooth has been dead for a long time, it is possible that when we extract the tooth, that we have a dead space, and some anaerobes might have been living inside the dead tooth, and when we extract it, then we have an area where anaerobes can grow. So in that case, we'd give antibiotic, but the antibiotic must be given before the surgery so that we have therapeutic levels in the blood clot that develops. If we do an extraction of a tooth that has been dead for a long time, and we have a clot that develops, then we suture closed, and then we give antibiotic, there's no way the antibiotic is going to get into the clot. So always make sure the antibiotic level is at therapeutic levels before we do the surgery. Does chlorhexidine stain teeth? Apparently in humans it does. There's no evidence that it does in animals. Longitudinal crack hairline in the mandibular canine of a German short-haired pointer from the tip of the tooth to the subgingival level. X-rays were not available. Can one assess whether to extract without radiographs? No, one can't do dentistry without radiographs. Helen, thanks for the question. Always take radiographs. We don't know what's going on around the tooth. So if there's a small crack, it might be insignificant. The tooth might be completely healthy. The crack might only be in the enamel. However, if it's gone into the dentine, it might have affected the pulp. In that case, we might have a periapical lesion, in which case the tooth needs to be extracted if the crack has gone all the way down. If the crack remains supragingivally, in other words, above the gingiva, it might be possible to do root canal treatment in a tooth that has a dead pulp. So yes, radiographs are essential for us to be able to make the decision. Do all extractions need to have sutures closed, or are there exceptions? Okay, if the tooth is completely wobbly, a 3-rooted tooth, completely wobbly, and when you examine it, it falls out, then I'm not going to create a flap. Okay, so in my hands, if I disrupt the gingiva, then I'm going to suture closed. So if I have to open the gingiva for any reason, then I'm going to close it. But I don't go and make a hole where I don't need one. In other words, if the tooth is so loose that the tissue around it has started healing already and it's a very shallow defect that is there, then I'm not going to create a flap. If, however, a canine falls out, and these do from time to time fall out, there is going to be quite a large cavernous area there. And that is not going to heal for 6 to 8 weeks. So in that case, I will create a flap. Even though the tooth is already missing, I'll create a flap, remove a little bit of bone, debride the socket completely to remove the epithelium from it, and then reduce the level of the buccal bone slightly, and then suture close. I might have to expand the flap. Remember, flaps mustn't have any tension in them, otherwise they're going to fail. Okay, Shirley, I'm at the end of the list of questions. I don't know if there are any other questions, and I'm sure we're close to being out of time, but I'm happy to answer questions. If people want to get hold of me afterwards, they can. My email is my name and surname, cedrictut@gmail.com.
Okay, there's one more question on the chat box. Dr. Rose Kennedy Smith want to know that, do you have any comments on treatment of dry socket?
Okay, dry socket is extremely uncommon in animals. I think there's only one presentation that I saw at a congress once that described a dry socket. Dry sockets are something that is seen more commonly in humans, and the reason why we don't see them so commonly in animals is that we suture the extraction site closed. So if there is a case of dry socket, then the bone needs to be debrided. Remember, the bone is necrotic, and that bone will need to be debrided, and we would need to create a substantial flap to close it. So yes, they can be treated, but it's something that we're going to do, as I say, based on radiographs and clinical effect or clinical picture. But yes, it's going to require some surgery to fix, and also it's going to require antibiotics because the necrotic bone that is there will be harboring bacteria, and there's no blood supply going into that bone. So remove the necrotic bone, have the animal on antibiotics before we start, create a flap and suture closed. And then please remember, the animals must not eat anything hard, otherwise they're going to disrupt the sutures.
Okay, so thank you so much for Dr. Cedric Turt. Thank you for sharing your expertise and practical tips. And we come to the end of today's webinar. If you need more information, you can either send us an email or follow our social media accounts as shown in the screen. And we will announce our next academic on it. So thank you very much. Goodbye, everyone. Wish you a good night. Thank you, Dr. Cedric.
Thank you. Thank you.
Thank
Good
you.
night.
Thank you, everyone. Have a good night.
Bye-bye.
Bye-bye.